Good afternoon, everyone. My name is Dan Harris. I'm President and CEO of NuPath, and this is our first experiment, our first trial with this exciting new platform that we call NuPath Live. This is a way for us to enhance our production quality of the town halls and the Unity forums that we've been hosting since the COVID pandemic first began in March. And while we had worked very hard to prevent the old way, this is going to push us beyond our comfort zone. Brett reminded me just a few moments ago that there's a sign above my television right now that says, if you don't make mistakes, you're not really trying. It's easy to do things perfect when you don't try new things. And we at NuPath ever committed to pushing ourselves beyond our comfort zones in order to achieve the very best. So we are looking forward to this event today. And going forward, we've decided that we are going to host just one virtual event per week. This will happen at this point, at this time on Thursday. And it will be a combination of providing you with data and information that you need in order to go about your work, or if you're a family member, information about this agency that will help you in making decisions about your loved one. Also, a way for us to keep an eye on the data, any concerning trends, or any information that is necessary or has come to us through the CDC, DPH, or the Commonwealth. So we're going to begin our time together today by taking a look at the data. I know this is something that some people may find inconvenient or as not as interesting, but I think it's important. So we're going to look at the data of Massachusetts when compared with the United States and with the world. So currently, we are at 9,647 deaths that have occurred since we last looked at this. We're at a total number of COVID cases of 141,000. And that number of deaths is an increase of 117 from the last time we looked. Nationally, we are at 217,000 deaths with 7.95 million confirmed cases. The deaths are up from the last time we talked by 7,000. I just got to stop. 7,000 deaths. It's the increase from when we talked last. It just boggles my mind. And then globally, we are at 0.109 million deaths, 38.7 million, and that's an increase of approximately 20,000 from the previous time that we looked at this. So what does some of this data mean? We thought we'd break into it a little bit. So as of this morning, I received a CNN alert, and it was an article talking about some concerns from a number of prominent health experts. We are now averaging, as a country, more than 52,345 new cases every day. That's an increase of 16% nationally. So that's a concern. In fact, just yesterday, October 14th, we had 59,494 new cases. So this is a trend that is increasing. Current data tells us that 35 states across this country are showing increases of greater than 10% from the previous week. There are 3 states worth mentioning that are level or that have decreased, actually, their number of new cases, and those states would be Louisiana, Kentucky, Vermont, and then Massachusetts falls into the 3rd category, and those are the 12 states that are holding steady. So this means that we are kind of holding our own in the spread of this pandemic. This is a good thing for Massachusetts, but still, there are 21 states, the same article discusses, that hit their 7-day peak average of COVID-19 during the past week. We talk about hitting peaks in April for Massachusetts and New York and other states in the Northeast, California. Much of the center of the country did not experience some of those peaks that we did, but these peaks are coming a little later for 21 states. And Dr. Peter Hortez, Professor of Dean of Tropical Medicine at Baylor College of Medicine, said this is a very ominous sign. I think we're in for a pretty bad fall and winter. Dr. Hotez goes on to say, this is the time when we could be entering one of the worst periods of our epidemic and one of our worst periods in modern American public health. And then he wrapped that up by saying, I am very worried for the nation. We don't want to think about what fall and winter could be like if we have to shut down again. And so this is a word to the wise. Wear your masks. They are still considered to be the number one and most fundamentally important way of preventing the spread of this virus. And we have got to be vigilant and do our part, not just as citizens, but as members of the NuPath community. And I can't say it too much. And if anybody out there is sick of hearing me say it, then that means that I'm doing my job. Wear your mask, guys. We are going to be talking to Dan Lannon now, and we're going to go down to who happens to be with us in Jubilee Park. Dan and Mike Edwards are here today to discuss what looks to me, from this vantage point, to be a sea of orange festivity. Orange pumpkins. Dan, what's going on down there?
Hey, thanks for having me. I'm alive at 147 on First NuPath Live, so this is exciting. Today there was a big pumpkin carving contest, and so we right before we went on live, we judged the pumpkins, and we had a lot of individuals here helping us judge, and we picked a winner for today. I want to bring in Mike Edwards to just talk about the activity a little bit.
Thanks, Dan. So today we had over 75 pumpkins between Martin Center, 147, Westford, and all the houses. And we judged it all the way down to one per building. And then I asked Dan to pick his favorite between the two buildings. And here we are.
All right. So the winner, without making anyone wait, I feel like Matt Noyce from NECN is right here. Do we have a name for him, Michael?
We were just kind of calling him Bat Wings.
Batwings. All right. This guy is fantastic. I think there's only one thing that could have improved this guy overall. Was to maybe to fit in with the current environment that we're all experiencing here.
Nice. Excellent.
Dan Lannon, that is why you that's why you're senior vice president of operations, because you have an eye for the details that matter so much. Thank you for putting that mask on, Mr. Batwings, is it? Is that what we called him? You know, Dan and Mike, I don't know how things are going for you, but from my perspective, things seem to be fairly orderly. As see people arrive, the continued cleaning of the building. How have things been for you over the past few weeks?
It's been great. We just came on, I think we're talking about our 10th successful week opened. Between Westford and ourselves, we don't have any cases. We're keeping up on cleaning. We're being vigilant on cohorts. Participation in activities and virtual programming continues. And I think all three buildings in the houses are doing what needs to be done.
And I know that there was a all-day testing clinic right outside in the tent there. I had my COVID test. I'm going to be talking to Dan in a minute about how we're responding as an organization and the surveillance testing. But you haven't gotten a test, have you, or did you get one?
I've actually been tested twice in the last 3 weeks. Once through NuPath nurses and once with the agency over in ARI. And then, yeah. So here I am.
Good for you that
3 weeks.
Then you're exceeding the expectations, and you're one of the warriors we like to celebrate them, because we need everybody doing their part. It's good to know that you did that. And did you do the spit or the swab?
The ARA one was the swab up the nose, the brain tickler, and then the other one was the spit test.
Yeah, I've had both too, and I tell you, that spit test was a little bit more challenging than I was expecting.
Yeah, but I liked it better.
You did. Well, I like that it didn't feel like you were underwater with water gushing up your nose, but it took me a while to fill that little vial with spit. It was pretty disgusting. You want to do it where you're not have to, somebody's not staring at you the whole time, because
Yeah,
you can't drink or eat before you do it for half an
Exactly.
hour. And then just the knowledge I was going to have to produce however many ounces of spit,
right.
put me off a little bit. It's really gross that I'm talking about that now. I just realized that it's kind of disgusting, but it's what we need to do, and it's important. Well, congratulations on arranging this great event in advance of Halloween and in celebration of well, I guess it's all Hallowed Eves. It looks like people had fun, and you had some great entries. And congratulations on the winner, to
All right.
Batwing.
I don't want to take all the credit, but we had lots of help.
Well, thank you all there, all boots on the ground, and all the staff and people in Westford that submitted their entries. And I'm glad to see that all those pumpkins should have masks on, if you want my opinion. But we'll just stick with the winner. Thank you, Mike. Dan, do you have a couple of minutes now? If we come to you and you can kind of fill us in on a few things, and if there's nobody around you, maybe you can take your mask off.
All right. Yeah, no, that's fantastic. I love to follow up the spit conversation too. If we can
Yeah, yeah.
go back.
Yeah.
into
Well, did you do it? Did you get that test? The
I
spit?
have, yes. I've had both now as well. So
It's a bit you have to produce, isn't it? It's
yeah, yes.
when Sharon Pitts told me, show me the line, I said, what? It's gonna take me a lot of time. So how are things going, Dan? We've learned that we've been under the surveillance testing. We had to get all of the residential and anybody connected with the residential teams tested, which is something that we've been working on. We had I think until the end of the last month to do it, or into, I forget when the deadline was. And now we're going into a new phase where it's 50% of our staffing every 2 weeks. Can you tell us what that's all about?
Yeah, I just to recap a little and to explain like what Mike was saying, where we went through two different tests, because we certainly did have that first round of baseline testing, for which we were all 100% compliant, and now we moved to the surveillance testing. And again, yesterday, as you got tested, and I myself got tested as well yesterday, that sort of wrapped up that surveillance testing for round one. Now we found out today, because the central Middlesex area that we're still in the red. And so now we'll have to move to testing 50% of the staff every 2 weeks. And so we'll have to be rotating that to get, the 100% of the staff every other week, every other 2 weeks. And so, basically 100% of the staff is the way we're looking at it. Once a month, we'll have to be tested. Most simplistic way to look at it, I think.
And Karen Franklin said that there'd be additional instructions that would be coming out early next week regarding which would be the first, which houses first and so forth. Is that how it's going to work?
Yeah, I think, I don't want to give anything away right yet. I know we're working on that right now. I think we're waiting for all results to come back from this surveillance testing before we set anything up on that. But again, early next week, I think we should have that information, and that should get out to staff. And I know the first day, certainly here of us, our nurses completing the testing was a little challenging. But from what staff have told me, for all the other days have gone very smooth, and yesterday it seemed to go very smooth when I participated in it too. So I just want to thank the nurses and the teams that sort of worked behind the scenes to make sure that happened and made it go smoothly. So, but I think we'll have more information early next week on the other process for the 50%.
All right. I've been looking at the background as we've been talking, and I just saw a van load up and pull away, and I've just been shuddering, hoping that I didn't see anybody not wearing their mask. But from our point of view, it seems that people have. So much of what we're doing is such new territory, and you mentioned how things went a little bit more smoothly with the testing. We're all learning new things that we've never done before. I mean, none of us have it in our recent memory, or any memory really, for that matter, related to the concept of having to test for something in order. I mean, most of us, it was a TV test would maybe upon higher, but that seems like a faraway thing. Are you finding that as people are just as we're more and more exposed to things, that there just is a more fluidity about how we can, sort of comply with these areas? Is it something that you see we're making progress in kind of getting it baked into our, enculturated into our staff, or is there still a lot of, sort of clumsy response to things?
No, I think certainly more so that I think it's almost systematic. It's baked into what is the routine now, is the protocol, and it's allotting for more time for everything. I think we've all sort of experienced that through life. We're just allotting more times because we know that simple run to the corner store isn't maybe as simple sometimes, because we got to wait for the numbers to decrease for people in the store and stuff like that. So I think staff and really everyone, families, individuals, everyone has been tremendous with the compliance on wearing a mask, and the general cleaning that is taking place out in Westford with Brian and his team at the houses and here at New Boston Street is just great to see, and that itself takes a lot more time and has people doing different roles that they really never filled before. But I think we have a great team, and I think people have really stepped up and pitched in, and I know, our numbers as far as individuals at locations have increased a little bit, nothing to the level of capacity at all. And I think it's good to be able to sort of, like, as Michael mentioned, it's our 10th week here, is to learn from those early days when we had very small numbers to be prepared for these, for the people coming on and onboarding, as we're calling it, at a more sort of regular basis. Because I think that's what it is. I think, it's not like everybody's starting Monday and hey, day one, everyone's starting. It's we work with the families and the transportation and try to get people started on days that make sense and stuff. So,
Dan, at this point, if you're a family member out watching this now, or you're a family member connected with our services, would you say, how many families do you think are waiting to get their kid back, that wants their son or daughter back, but due to some other reason they've not been able to get back? Or do you think we're ways away from that?
Yeah, there is a lag in transport. I know that we've tried to facilitate a number of those transportation routes. We do have to go through our process with a PT1 process, which they streamlined a little bit this week. I think what it comes down to, and hearing from Mott, who is our regional transportation company, is that there's just a limit of actual vans to drive people if you're only driving a third of the capacity. And everyone can understand that. If a van typically had 12 or 13 individuals in it now, and it can only have up to 2, we're doing, second runs and in some cases third runs, and how much how that can be sustained and how we move forward, I think is going to be the measuring stick. But I think the numbers of people that maybe we haven't heard from are very small. There are a few people that we've heard from that have said, yes, I'm just not ready right now, but if you can help me secure transportation, hopefully by transportation, I'll be ready. And that's how it is. And some people, let's be honest, just like schools have picked a hybrid schedule. They're not ready to come, full time 5 days a week, and they pick, 3 days a week and stuff like that. So we're trying to, I guess, just be as flexible as possible. And luckily here at this location and in Westford, right, we have, a large space, and we're able to make sure that everyone is socially distanced and comfortable. So,
is there anything else that you'd like to mention to us or say before we let you go?
I guess the only thing I would say is what my mother said this week when she had to have her own COVID test and go to Leahy for some other testing, was that I said, how'd the COVID test go? She's like, I think I passed it. I think I got an A+. So far, every location when staff gone through, we're getting an A+ with the testing, and we'll just hope to keep up with that.
All right. Well, it sure is a gorgeous afternoon. It looks beautiful out there. And we really want to tell you how much we appreciate you taking the time to kind of connect with us and talk to us. And I give you an A+, Dan. I think you just deserve that mark, because it was good. Good report. Thank you.
All right. Thank you very much. Take care, everyone.
All right. We decided that we were intentionally going to keep today's first sort of maiden voyage brief, and we'll be doing more promotion around that. This will be available to see on YouTube, or people are watching it live through. I don't understand all the specifics, but this is going to provide some hope for some continued growth for us and how we communicate with people and how we find people where they are. You know, some of our staff don't read their email, but they probably don't go an hour without checking their Instagram. And if we can find, you know, better ways to sort of, you know, get our information that's relevant and important to NuPath out to people, we're going to do that. You know, I was thinking as I looked at that beautiful, you know, scene and sort of wishing I could be outside myself. And right now it feels in a way that you know, it's hard to you know, imagine this deadly virus that's still continuing to kind of hunt us out there in this microscopic, you know, sort of world. And so I've been thinking a lot about the weeks that we have before us, and got some big things coming up. We've got the election in just a couple of weeks, really, and that's going to be a doozy. And there's of course a lot of you know, general uncertainty about just how the pandemic is going to affect voting and people that have are doing the mail-in ballots. If you know, this is obviously an important election, and we want to make sure that we're participating fully. I've also had this sense of wanting to sort of batten down the hatches and make sure that we've got everything tight in the event something should happen. Personally, I'm moving my mother to a first floor apartment so that if for some reason we're locked down again, I could come to her window and at least have a window visit. These are things that we have to be thinking about. You know, it all came on so suddenly in March. We know that, and it seems like before I could blink, you know, there wasn't any toilet paper to be found anywhere for weeks. It may be different this time. We just don't know, because this is something that time will only tell. You know, what the future holds. But we will get through this together at NuPath. We got this, guys, and I know we can do it. We've had these extremely challenging weeks, months since March to kind of practice. And even if there is a surge nationally in this virus, or even in Massachusetts, there's no reason that we can't continue to just be vigilant and make sure that we are not doing anything to continue the spread. And we just hope and pray that we have some more medical intervention, some scientific intervention that will assist us to move on. So for all the staff out there that have been faithfully complying with our orders to get this mandated testing, thank you very much for doing that. We're going to continue to rely on your diligence and attention to these important matters. To our families that are out there, we thank you for your cooperation and for your patience in understanding that we are doing our very best to return things to as normal as possible while keeping everybody safe. That is our number one and most important priority above all else. And to the people that were here today, that made this possible today, Brett on camera, and Greg, what do we call you? Production manager or something behind the scenes. It really is quite involved and a different experience. So we hope you enjoyed this first edition of NuPath Live. We'll see you again next Thursday. We're just going to get better and better from here, because we got this, guys. Talk to you soon. Bye-bye.